The antibiotics should be used carefully, they should be used under medical advice and supervision. Complete courses should be taken and doctors should be informed and consulted with on every occasion. It is unwise to use small courses of antibiotics or incomplete courses for a sore throat, a cold or a flu, which are not the appropriate infection requiring antibiotics. The problem with antibiotic requesting is that there is a misconception that all infections require antibiotics. So what we often find in practice is that we're being asked for antibiotics for infections that won't get better with antibiotics, like viral infections, and they are being requested far too often, and GPs are under pressure to prescribe them. What's really needed is patient education, and that requires time to be able to explain to patients the differences between bacterial infections and viral infections, and infections which will get better on their own based on our clinical assessment of the patient, and infections which require antibiotics to get better. And we have to be much more economical and conservative in our prescribing to prevent increasing resistance, which is becoming a problem. If you look at the people who are most susceptible to illness, the elderly and the very young, or those with immunocompromise, in other words, those whose immune systems are weaker than what we would expect for a variety of reasons, whether it's cancer, viral illness, etc., those individuals are the ones who are most likely to suffer if the first line and second line antibiotics are ineffective.